Medical Monday now, Dr. Richard Windsor from BayCare Clinic joins us. We are talking about Prostate Cancer Awareness Month, month of September. Talk a little bit, first of all, what is the prostate and what kind of cancer is, going along with this?
Sure. The prostate is a gland that produces the fluid for semen, and it wraps around the urinary passageway. All the urine has to pass through the middle of that gland.
And when people do develop cancer, how does this, is there a typical age that this happens at?
Well, generally we start to see it more common when people are in their 50s, and it gets common as men get older and older and older. If someone's father or brother has prostate cancer, well, it's more common, so we recommend starting the screening for it earlier. Unfortunately, we do have good screening.
Okay, and that's what I was going to ask. What is the screening process? How do you detect this? What's that like?
It's basically very simple. It just involves a blood test. And if there's relatives that have the cancer, we start at age 50, otherwise starting at age 60 on an annual basis, and also a physical examination.
So what causes this cancer?
Basically, it's genetic, is all we've been really to determine, but there's higher risk factors if someone's African American, again being genetic. Also testosterone supplements or other vitamin supplements.
And we do have a graphic that we would like to pull up on the screen right here. These are some of the things that might, enhance your chances of getting prostate cancer, would you say?
Right.
Okay, so African American men, testosterone treatments or vitamin E. How does that typically play into it?
They're associated with it, but the strongest things are the genetic things being
and family histories.
History and African American and older are the biggest things.
Sure, and I never heard the diet high in dairy or calcium.
Right, that's something that may be true, but again, it's important based on the patient's age and family history is the most.
So that's why you would say it's so important to know your family's history and to get tested early and to just talk with your doctor. Do you find that men are a little bit more hesitant to come in and chat with their doctor about something like this?
They may be. They go see their doctor. Their doctor is generally aware of this, and then we'll make recommendations to them about it.
Do sometimes wives push their husbands to go in and get tested?
We have them bring. It's time for you to get checked now.
So the wives out there and people who are generally concerned, tell their husbands to go and know your family history, and if you feel like you need to get tested, just open up that dialogue with your doctor.
Right, and daughters are important too. So.
Daughters, absolutely, because they're going to push their dads to go in and get checked.
That's right.
Because is this a treatable type of cancer, would you say?
Very treatable, very curable if caught early. 220,000 men get it a year. It's the second most common cancer. However, 95% curable if caught early.
Wow, that's a really high rate. But again, the key is the early detection. All right, wonderful. Thanks so much for being with us, Doc. We appreciate it. For more information about prostate cancer, just visit our website, click on this story. Today's Take is coming up next here on Wisconsin Tonight. Stay with us.